All right, we're back with another episode of the Urogenie podcast, and this is going to be an introductory episode where we go over some of the basics of uroflowmetry. What is it? What is it used for? Why is it important? And sort of what are the limitations that are currently in the field as of 2022 and what we can expect to see in the future. I'm going to be expanding on this topic with experts and interviews with urologists to give you an even more in-depth view on all of this, but this today is going to be just an introduction on what exactly is uroflowmetry. So a uroflow test is a very basic test that's performed every single day, hundreds of thousands of times across the world by urologists and urology providers for their patients. And it's a very non-invasive exam. It's simple, painless. You basically just go into your doctor's office. It's for men, women, and children. Anybody that might be having a problem with their urinary tract, whether it's from an obstruction or an inability to empty their bladder, or some sort of infection, pain, or just a checkup for cancer, or some issue with the prostate for men. It's a simple test where you go inside the doctor's office and you're going to be peeing into a special cup which has a measurement function on it. And what does it measure is it measures how much you pee, the flow rate of the pee coming out, and also how long it takes you to completely empty your bladder. And it also checks if there's any kind of obstruction. Those are the main four things that it's checking. So the test helps your urologist determine if there's any issues with your bladder, or if there's an infection, or for whatever reason, if there's some abnormality in how much you're peeing. And as I said, it's a very painless test. There's nothing really to it. You just go in and pee. One of the main problems that urology offices complain about is that people show up to the test and they don't need to pee, or they don't need to pee enough, or they didn't drink enough water prior to the test if they forgot about it, and they show up basically without the urge to pee a good amount. So the best test for a doctor in terms of uroflowmetry is if you're going to be peeing the way that you would be peeing at home, so there's no obstruction, or like there's no anxiety related to it. And that's another problem, is that sometimes patients show up to the test, they're ready to pee, they have enough hydration where they'll produce a good sample, but the problem is that they are nervous, especially with children. They don't feel comfortable giving the exam at a doctor's office or away from their home bathroom. So one of the deepest innovations that's coming in uroflowmetry is going to be the ability to perform this test at home for doctors to, and still bill for it insurance wise. So there's going to be major disruption in if we can figure out how to have a test that's accurate and able to be performed at home, and in the comfort of home. And this is also for monitoring too. So if your urologist would need for the patient to be constantly monitored while they're giving this test, say once every other day or once every morning, where the morning is going to be the best test result, that's the preferred time of the day to give a uroflow sample. That is going to be one of the major disruptions, is the ability to do it at home and be tracking it wirelessly through digital uploading of the information, where so the patient doesn't have to come in and disrupt their day and go into the office and pee and wait to pee and wait for other people in line and all that waste. The way that medicine is moving is that more and more non-invasive things can be done through telemedicine and through remote medical procedures like this, where it's not like a surgery. You don't need to be in the office with the doctor to give this type of sample. So that's one of the first major disruptions. The other disruption is the process today is very old school and time consuming, where you have The person come into the office, they do the Uroflow test, and then it prints out a paper of the result, and that paper then has to be scanned into each patient's file. So it's very, very, very old school, very, very, not a modern way of doing a medical test, whereas something like this should be fully automated, where the patient is providing the test and the result comes out and it's automatically uploaded to their electronic medical record. You can see all the previous ones, you can search it. And right now, the major limitation is it's all done by hand. They use a standard uroflowmetry device, the patient, that is, then the medical provider prints out the result. They then have to scan it in for each patient. You can obviously infer that this is going to lead to lost results. It's going to lead to errors in uploading the wrong one for the wrong patient. Imagine if you're doing 50 to 100 of these a day, which some major providers are, because some providers have 10 urologists in the office. Each one does 5 a day for 5 patients. You have 50 going on. You can easily see how all this paperwork would just become like a mess. So on top of these two main limitations, there's also a ceiling, because it's so time consuming to do this whole process of loading the patient in, getting the patient ready, having them pee, emptying the chamber for the next patient, making sure it's clean, then uploading, of course, the records, then billing for it to Medicare or whatever insurance they're billing. You can see how there's a ceiling as far as the business of urology goes. There's sort of a ceiling being put on them on how many of these that they can bill for, or basically also a ceiling for patient care of how many they can perform per day. So the more you can do, the faster you can service all of your patients, or more patients in the locale where you live. So these points are the bullet points of innovation that we're going to be discussing on the podcast here. This space is ripe for disruption because of these very, very outdated methods of doing such an important but basic test that really probably most listeners and most people here will have to do at some point in their life. So it's something that we're going to be discussing, like I said, with experts and other people in the field. So make sure you do stay tuned for that. This podcast was just supposed to be an introduction to uroflowmetry and an overview of what it's used for and why it's done and what are some of the disruptions that are possible in this field. So I hope you did enjoy that, and you will be sticking around for future episodes of the Urogenie podcast. I will see you then. Have a great evening or great day wherever you are. Bye.